Hello, everybody. Thanks for joining this press conference. I'm Gabriella Stern, Director of Communications at the World Health Organization. And this is the press launch of the 2023 Universal Health Coverage Global Monitoring Report. And we're coming to you from UN headquarters, from the press briefing room. But we also have participants joining virtually. We're going to kick off immediately. I'm going to introduce our initial speakers, and then we'll move to media Q&A, at which time I'll introduce a few technical colleagues who are also going to join in case of technical questions. So we're really fortunate to have three distinguished speakers today. Dr. Samira Asma, Assistant Director General for Data, Analytics, and Delivery for Impact at the World Health Organization. We have Dr. Juan Pablo Uribe, Global Director for Health, Nutrition, and Population at the World Bank, and Dr. Bruce Aylward, Assistant Director General for Universal Health Coverage Life Course at the World Health Organization. I'm going to ask our speakers to make some brief remarks, and then we'll go to the Q&A. Thank you so much.
Thank you, Gabby. Good afternoon. Thank you for joining us today at this significant event, the launch of the Universal Health Coverage Global Monitoring Report. This report represents a collaborative effort between the World Health Organization and the World Bank. This is a report card on world's progress towards 2030 UHC target. It uses recent data to track coverage and affordability of essential health services. From 2000 to 2015, there was significant progress towards UHC. Since 2015, our pace of improvement has slowed down to a near halt. A staggering 4.5 billion people, that is more than half of the world's population, were not fully covered by essential health services in 2021. Furthermore, the chance of incurring financial hardship and catastrophic health spending is high even among those fortunate enough to have some access. There are important lessons in the details of the data. Substantial progress has been made in tackling infectious diseases, particularly HIV, TB, and malaria. This is a testament to concerted global investments, a reflection of true political commitment. To reach UHC coverage in every country by 2030, we must invest more and better in primary health care as the center of our health systems. And we must care for people to prevent and treat non-communicable diseases while solidifying our progress against infectious diseases. Investing in primary health care is of particular importance in light of the devastating impact of COVID-19 pandemic, climate change, conflicts, and other emergent threats to global health. As we stand at the midpoint on our way towards these global goals, this report is a stark reminder that billions of people remain deprived of life-saving essential health services. The gains the world has made in improving care for infectious diseases and maternal and child health show that investments do pay off in economic returns and, most importantly, in lives saved. Now is the time to invest in primary health care with substantial increase in financial resources to match the ambition. To double the pace of our progress, political will and investments are necessary but insufficient. We also need to accelerate progress by leveraging innovations, data and delivery, digital solutions, and partnerships. I want to particularly emphasize the critical need for robust health information systems to bridge data gaps within and about our healthcare system, monitor and accelerate our progress in real time, and ensure that quality and equity remain at the forefront of our efforts. I want to thank you for your attention, and now I will pass the floor to my colleague, Juan Pablo. Over to you.
Thanks, Samira and Gabi, and thanks to all of you for being here with us and for taking forward these very important messages. My appreciation also on behalf of the World Bank to WHO colleagues and also the bank team who have worked in this global monitoring report. Two core messages, starting fully aligned with Dr. Samira, the importance of advancing with universal health coverage. That means access to health services with financial protection for everybody. And it's extremely important because it's a great determinant of human capital and future social and economic development. And second, this message that more needs to be done urgently, as what we've been doing is not enough, and more public spending and more health systems investments are needed. Samira already showed how access to health services has stagnated in the last years. The report on financial protection shows an even worse message. Financial protection, especially for the poorest and most vulnerable, has deteriorated up to 2019. 2 billion people globally are suffering from financial hardship due to the costs of health services. 1.3 billion people are going deeper into poverty, and among these, 344 million people have been pushed into extreme poverty or further pushed within extreme poverty. That said, we can conclude that ill health remains a major cause of poverty, and it shouldn't be like that. The burden of these numbers among the poorest also will lead to increase inequalities around the world. So to change this, again, and this is my closing message, we need to prioritize health and the investment in health systems. The World Bank remains ready to support countries and to partner with others, like in this partnership with WHO, to collectively address this challenge and speeding up progress to universal health coverage in our countries and regions. Thank you. Bruce, over to you.
Thank you very much, Juan Pablo, and good afternoon, ladies and gentlemen, members of the press, and thank you so much for joining today. I want to make a few final comments just on the context for today's report, and then some of the consequences as we look forward. First, as you're all aware, on Thursday, in just a couple of days' time, the world leaders are going to come together and they're going to look at where are we on progress on the commitment that we made just 7 years ago in the Sustainable Development Goals to achieve universal health coverage. Now, remember, when we say universal health coverage, we're talking about two things, as my colleagues have outlined. Number one, how much of the population is covered by a basic package, an essential package of health services. And number two, how good is financial protection, meaning that they do not become impoverished or further impoverished simply by trying to access the health services they need. So what you'll find on our websites, Juan Pablo, today, is this report. This is the report card that Samira just referred to. And it's a rather alarming report, almost damning report, quite frankly, because as you've heard, on the first half of that goal, half of the world's population, more than half, are not covered by essential health services, and 1 in 4 are suffering financial hardship in trying to access health services. And this, ladies and gentlemen, should be truly alarming. It has been extremely difficult to make progress on UHC over the most recent years, and someone's unmuted.
May I
Someone
ask,
clearly shares our remarks.
could you please mute?
Great. I think we're muted. Great.
Yeah, thank you.
Yeah, so to the point I was just making, it's been very difficult to try and make progress on UHC over the last few years. We had the COVID pandemic, but the reality is, as Juan Pablo laid out, progress was stagnating even before we got into COVID. COVID made it more difficult is the reality, and some of the numbers even precede COVID, quite frankly. The situation, if anything, has gotten worse. And as we look at the 7 years ahead of us toward 2030, it's even more difficult to create health and well-being. We're dealing with climate and severe weather, as you're seeing and experiencing way too frequently right now around the world. We're dealing with crises and conflicts, and we're dealing, of course, with the fiscal constraints that, Juan Pablo, you're always speaking to as well. So it's going to be even more difficult, which means on Thursday, even more important that the commitments and difficult choices are made. And they shouldn't be difficult choices to create health and make the choices needed to provide basic services, just the most basic services to people everywhere. And ladies and gentlemen, this has real consequences because if you look around the world today, 17 million people are dying prematurely due to non-communicable diseases. 5 million people are dying every single year due to preventable communicable diseases. 5 million kids, less than 5, are dying from treatable, preventable diseases. And probably most terrifyingly in some way, nearly 300,000 women, one woman every 2 minutes is dying because we can't access basic services, have safe pregnancies and deliveries. And these are the reason we need to make progress on UHC, because you can't tackle that burden, you can't move forward economically, socially, developmentally without tackling this reality. The other thing we need to be clear on is you can't make a choice, you can't make the wrong choice and say, I'm going to tackle service delivery or I'm going to tackle out-of-pocket payments and financial protection. You have to tackle both of these things at once. And if we look back over the last few years, only 30% of countries were able to make even incremental progress in that regard. But on the flip side, there is evidence that it can be done. Countries are making progress when, number one, the political will is there to make that choice to do so. So, members of the press, our concern as we go into Thursday is the commitment to health for all is becoming a commitment to health for some and more health for some, and that is just not the right choice. So as we look forward, ourselves working with our bank colleagues, our UNICEF colleagues, and our other colleagues, we're fully committed to do our part, monitoring what's happening, finding the best evidence about what works, helping you look at the smartest investments, advocating, and then providing the technical assistance on the ground, because it's tough to move this agenda, but there are real solutions. But our ability to move that requires the political leadership and the right choices right at the very top. And that's what we're hoping we're expecting that this report will motivate and catalyze as it comes out today in the run-up to Thursday. So with that, thank you very much for joining. Thank you for everything you're going to do in trying to get this message out, because it is the most important message this week. People have got to have basic health, basic well-being if they're going to thrive, and as societies we move forward. Thank you.
Thank you, Bruce, Juan Pablo, and Samira. We're now going to go to media Q&A, and we are lucky to be joined online by some technical experts and colleagues. Dr. Kristen Fergus, who is with WHO, and Dr. Sven Nielsen, who's an economist with the World Bank. And in the room, we have Dr. Tessa Edeher, Acting Director for Health Financing and Economics at WHO. And my colleagues will tell me if I've missed any of our experts who are online as well. No, we're good. So I'm going to open the floor for questions. And just as a reminder, we have about 20 minutes. So when you speak, please identify yourself and your news outlet. And we're going to start with one question per outlet, but then we can loop around and you can ask another question if time permits. So I'm squinting to see if there are any hands raised from the news media. We also have some written questions that we can ask. Yes.
Yeah, it's Maya Plants from the UN brief. My question is regarding the Sistema Único de Saúde and the national health systems. A couple of weeks ago, BBC World Brazil reported on a story that while the Brazilian system of primary health care has taken inspiration from the national health system of Great Britain, nowadays there is also the other way around. The Sistema Único de Saúde in Brazil, called SUS, is the basic healthcare system in the country, has been teaching some things. People from NHS, doctors from the UK go to Brazil and learn from those experiences of primary healthcare, of having someone, for instance, go to communities instead of having the person sometimes who cannot afford or cannot go to a healthcare center, primary healthcare center. They will go and make rounds. So experiences as such shouldn't be highlighted too in this moment also, that we can try to help countries, developing countries as well as developed countries who need a boost in their primary healthcare system. Thank you.
Really good points about sharing. I'm actually going to invite each colleague to speak because what you're discussing is really relevant to all of their work. Samira, do you want to go first? Well, let's go down the line. Thanks.
Certainly. Thank you very much for a very important question, because Brazil has a long tradition of primary health care. And not only Britain, but other countries have followed the successes over time of Brazil. With regard to sharing the experiences, there is a compilation that is put forth on primary health care in many countries that will be also launched in a couple of weeks' time, and that will also feature the Brazilian example. One underscoring point is in terms of the payment systems, as well as looking into the future, how do we ensure that the health workforce is stabilized given the shocks that the system has experienced from the COVID pandemic. So those would be my thoughts I would share. Thank you.
Thanks, Samira. Juan Pablo?
Thanks, Gabi, and also thanks for that very good question. Quickly, 3 reactions. The first one that comes with your very good question is something that we also underline in the report, and it's that the challenges of achieving and sustaining universal health coverage are challenges that all health systems face, not only low and middle income countries, also high income countries. So this has to be a permanent priority and a permanent effort. That's the first one. The second one, and thinking about el Sistema Integrado de Salud, SUS, is also that in spite of very different models of health systems everywhere and respecting the differences country by country, there are 2 characteristics that I would like to underscore here, which are always important. One of them is the integration of the system, private and public, across different levels of healthcare complexity, etc. And the second one is the aggregation of risk in order to be able, precisely as we're discussing here today, to bring financial protection for everybody. What we call this risk pooling is extremely important to have a progressive financing of the health system. And the third message is that learning and knowledge are both opportunities and assets that are hidden everywhere. We can always learn from others, and there's always knowledge in each and every one of our health systems. That's extremely important to capitalize, and it's something that in the bank we take very seriously, the knowledge that can be transmitted from country to country everywhere. Thank you.
Thanks, Juan Pablo. Bruce, over to you.
We're all clear where we want to land in terms of universal health coverage. Everyone have access to a package, and that package of services doesn't put you into financial hardship. But to steal a phrase from English, right? There's many routes to Rome. Is this phrase? So there's different ways to achieve and to get to universal health coverage, and part of it's dependent on the context. Part of it's on the development level of a country, a low income versus a high income country. country, the fiscal instruments that they have at hand to be able to solve the problem. And what we're learning, and one of the fantastic things that we're seeing, is not just the example that you provided, but many, many examples of countries interchanging ideas, like Juan Pablo said, to try and learn from each other how best to do this. But all of them are trying to solve the same problem that we saw as we came out of COVID-19, right? COVID just demonstrated 4 or 5 major problems. Number one, not everyone has access to the most basic service, the equity problem. Number two, the incompleteness of what was available to people. Some could get access to this piece, some could get access to that. The third thing we were finding was how fragmented it was. You got to go here for this piece, there for that piece, and there for the other. And then what's obvious to every country, as Juan Pablo and Samira alluded to, is it's unaffordable as well. Healthcare is just becoming unaffordable. And so looking for a solution to that, and you mentioned it, countries are taking a primary healthcare approach. And we had an extraordinary thing happen in May at the World Health Assembly when you had 194 countries agree that the path forward to universal health coverage required radically reorienting their healthcare systems away from a heavy hospital base. That's part of it, but really toward that primary healthcare approach that you mentioned. But many countries have set up their systems about how to deliver healthcare without going through a phase. They don't even know how to set up a primary healthcare system. And hence, we're seeing a lot of really interesting movements, like you said, where people are trying to learn very, very quickly. But primary healthcare is really, as much as anything, it's a set of principles. How do you make sure you have equitable approach, everybody has access? How do you make sure it's inclusive, and the population's part of sorting that out? How do you make sure it's cost effective and efficient? So we're in a very interesting period in history, quite frankly, where everyone is trying to learn and learn fast. Now, on the WHO side, working with our colleagues at the bank, et cetera, one of the things we're trying to do is pull all that information together, and we're building a huge compendium now. I think there's 250 examples around primary health care. We're having all sorts of webinars to try and share experience. We're bringing the world together, or much of the world, in Astana in about a month for the 5-year anniversary of the conference there on primary health care to look at, okay, what worked, what didn't, where do we go next, and really do exactly what you highlighted, share examples, because there is a way forward to universal health coverage. And if we don't get there, the consequences are extraordinary. We've seen the consequences of not dealing with health and prioritizing it at the top with COVID-19. We've not acted on the biggest lesson we learned in the last 5 years.
Thanks, Bruce and all. Just checking to see, squinting to see if there are any hands raised. I do have a written question. The question, my old eyes can't see it, but we have a question that says, it's a question about the interplay of market economies, corporate sector, and universal health coverage, especially in societies where UHC is seen as socialized medicine, a kind of negative. And what are your thoughts on how UHC reconciles with market incentives for innovation, but also how to explain or kind of get around the stigma around socialized medicine? And again, I can't read the name of the outlet, but it's a good question. Thanks. Samira, do you want to go first?
I'll pass.
Okay. Juan Pablo, want to tackle? Thanks.
Yes, it's a very contentious question, and it creates a lot of discussion. And I do not pretend to resolve it or to have the answer to it, but I do want to share that from experience, looking at many different health systems, beyond the ideological discussion, UHC, universal health coverage, is a reality that we need to achieve. And there are different ways to it. The private sector, in particular, has a lot to contribute to health systems, to health care, to health insurance, etc. And what is important is that its contributions end up through good stewardship and good regulation, adding to this public social goal of UHC. In other words, with proper regulatory frameworks, with proper stewardship, and not losing sight of the vision that we all want to achieve, I do believe that the private sector has to be a great player in achieving universal health coverage and maintaining it with proper quality of care in our countries.
Thanks, Juan Pablo. Bruce.
Thank you, Abby, and thanks for the question. You know, when we talk about UHC, I really take issue with the equivocating it with socialized medicine as if these are both dirty words, because they're both wrong, frankly. And first of all, when we talk about UHC, it's not just medicine. What we're after is the full end-to-end, all the way from health promotion, prevention, make sure people don't get sick in the first place to try and maintain well-being, and then managing right out through the treatment, et cetera, through palliation if necessary through the end of life. So it's a whole spectrum that we have to think through. And the second thing is the term socialized, which seems to have a bad ring to it in this. But really, what we're after is this is a basic human right, that people have a right to health, and recognizing that it takes, as we mentioned earlier, thanks to the question from Samaya, different routes to get there. And in some cases where you have a market economy and you're relying heavily on a market to actually deliver, that's one thing. But what we've learned is if you want to achieve access to health for everybody, it ain't going to work unless you really ensure that the public sector is deeply involved in ensuring access to service for those who are most vulnerable and not in a position to pay. It's as simple as that. And as soon as you introduce things like co-payments and joint payments and stuff like that, we have a lot increasing evidence. You introduce those, some people aren't going to get services, some people are going to forego services, people are going to die as a result of things that can be treated and prevented. So the reality is we need to do exactly what Juan Pablo said, you know, move beyond these ideological debates and just make sure that the people, the most vulnerable in populations, have access to services. And there's a really important role for the public sector and governments in ensuring that. And that is part of what we need to do. That's the reason we have governments, is to make sure that those basic services are provided. So we have a lot more evidence now that anything but that just will not achieve the goal of universal health coverage. It's part of the pathway to get there.
And I think, as one of you said earlier, this is not just about low-income or middle-income countries, but also high-income countries where there are real disparities in health in different communities across states and provinces and so on. Samira, I was wondering just if you could speak to the data gaps, the lack of data in different places that prevent us from actually seeing what's happening and what the needs are.
A very important question, Gabby, and there are significant data gaps, and this report highlights those gaps. The basic sign of good governance is that every country should be able to count births, deaths, and causes of death. And the current status in all countries is that we don't have good quality data on facts of life, that is birth and deaths and everything in between. And when we don't have good data, we are unable to target our investments at the right place and at the right time. So that is one. The second is to have real-time information on performance of care at the primary health care level. So the data that is coming in on patients and providers and the supply chain is used to improve the performance and the quality of care that is the fundamental basis of universal health coverage. And that is also very patchy. And finally, we also want to have timely and reliable information on public health, risk factors and determinants, as well as public health threats. WHO, along with partners, did an assessment in 2018 where we found that less than 25% of countries have the capacity to track health threats. And 9 out of 10 countries in Africa don't have death registration. So these are very significant gaps. And the reasons are due to lack of sustained investments in robust health information systems. And that is where we encourage countries and partners to invest in and not wait, because we are just halfway to reach the SDGs by 2030. And if we don't know where we stand, we will not know what stand we must take to meet the goals. Thank you.
Thanks, Samira. We have a question from Elaine Fletcher. It's a written question in the chat. She's with Health Policy Watch. Elaine asks, how do you make that critical leap to aggregating risk without socialized medicine? How can WHO and the World Bank do more to assess and promote models of what works? So it's really two questions. One is, how do you make that critical leap to aggregating risk without socialized medicine? Second question, how can WHO and World Bank do more to assess and promote models of what works? Or they're related questions. Can take them separately or related. I think I'm going to ask Juan Pablo because you mentioned aggregated risk first. Thanks.
No, so thank you, and I believe this is a very complex and in-depth question, and answering it would require a lot of time. There are different models for aggregating risk and also for pooling the financing, but I do want to go for what I think is behind the question, which is, again, the importance of securing universal health coverage as an ambition of our societies, of our communities, of our countries. And I just wanted to highlight something that Bruce also said, and it's the importance of the equity lens. So if we are really following carefully to make sure that the most vulnerable, the poorest, are not left behind, and rather that there's an intensified effort around them to increase their well-being and their potential and their human capital, I think we will be able to define the following models that may work, again, depending on each one of the countries. So I would say, again, different models for risk pooling, especially for financing it, but the equity lens is not negotiable. And that's a must that universal health coverage should have. As for different models, I would only say that in the World Bank, we have different mechanisms of networks, of flagship courses, and of permanent events, trying to make sure that the strengths and weaknesses that are proper in all of our systems can be fully analyzed and, based on that experience, share with others to avoid the latter and to, of course, build on the former. Thanks.
Thanks, Juan Pablo. Anyone else want to jump in on this? Bruce.
Yeah, I think the second part of the question, Elaine, and thanks, about what more ourselves and the bank can do to assess and promote models of what works. Well, the first thing we're trying to do is be very, very clear on what we're trying to achieve. And that's where the point that Juan Pablo made around equity, around the basic package, around the financial protection, being super clear on that. Then, of course, we have a huge program of work of trying to collect the experience. And we look very closely about the experience during COVID, experience prior to COVID, post-COVID. So we're trying to collect as much, as I mentioned earlier, experience, create a whole compendium around that. But then we've got to look at, does that experience, does what people do actually make a difference? And there you've got to then look at the impact, what's happening in terms of some of those key issues we talked about, things like the survival of, survival, I hate to use that term, but maternal mortality ratios, what's happening to the risk of women during pregnancy, what's happening in under 5 mortality, what's happening in terms of non-communicable disease. So you got to look at, is it having the impact? And is it doing so cost effectively, right? So you have to look through all of that. But then you also have to be very careful, and what we're trying to do is make sure we're not looking in one setting, because you've got to look what works in low-income settings and low-middle income, and high middle income, high income, and other settings, because it will be solved different ways. And as a big part of solving this is around financial protections and financing systems. You have different fiscal and monetary tools at your disposal. You have to look across all of those to try and gain that experience and be very careful careful that you're not taking a high-income model and employing, as has been done in the past, and then employing that in a low-income setting, because it may simply not be the most appropriate fix. So it's a huge piece of work, quite frankly. But at the same time, you can't wait around, study all of that. You need to be moving forward in the meantime, because the human cost of not solving this problem is extraordinary, as we talked about with some of the numbers earlier. 17 million people dying prematurely due to non-communicable diseases, heart disease, diabetes, cancers, or chronic lung diseases that can be managed. We still have 1.5 million people dying every year of tuberculosis, extremely treatable, manageable situation, as we'll talk about at the high-level meeting on Friday, et cetera, et cetera, et cetera. So you have to solve these problems as we learn. And as we learn, we're going to learn how to do it better, but that doesn't. It's not time to wait. It's time to move on these issues. We're halfway through the SDGs. We are flatlining in terms of coverage, service coverage, and we are deteriorating in terms of financial protection. And remember, financial protection sounds like an obscure term a little bit, like you said, Juan Pablo. But let's put it, really frankly. You are being impoverished by trying to seek health care. You are foregoing other basics. You're foregoing education, or you're foregoing housing. You're making really tough choices that you shouldn't have to make for such a basic human right.
Samira, would you like to jump in? Thanks.
The question about partnerships, I think WHO and World Bank are committed, as you have seen, jointly working on this report, but we will take it forward to continue to work with countries and partners to implement the recommendations that have been put forth from this report. Multilateral partnerships play a very important role, and so does the domestic partnerships with multiple stakeholders, as we have seen that health is so central to sustainable development. Partnerships with several stakeholders is going to be extremely important as we go forward with an aim and intent to accelerate progress, given the time is short and one partner cannot do it all. So we look forward to working with you, Juan Pablo.
Thanks, and we're about to close, but we have one question in the chat, which I think is very salient and will help a lot of people, which is, I'm confused. What is the difference between universal health coverage and primary health care? I hear those words used interchangeably, but sometimes they're used differently. Please advise. Good question. Bruce.
Yeah. Let's be super clear. Our goal is universal health coverage, that everybody has access to essential services and they don't suffer financial protection. A focus on primary health care is a route to get there, quite frankly. So what you're trying to do with primary health care and reorienting toward that is make sure as you pursue universal health coverage, you focus on equity first. You inclusive and involve the communities as you go. You focus on the cost effectiveness. So think about it this way. Primary health care is about how to get your prioritization right. The right things to the right people in the right order, everywhere. I shouldn't say in the right place, but everywhere. So primary health care's approach is a way to think about it. Often people talk about it, primary health care, as that lowest level in the system as well. But primary health care, actually, that's usually primary care. Primary health care it's the whole package in the right order and in an integrated way, quite frankly. So UHC is the big goal. Primary health care is how to make sure you're go there in the most efficient and prioritized area way that's going to save the most lives and generate the most well-being.
Thanks, Bruce. And I think with that we will close. We're at time. I just want to thank Dr. Samira Asma, Dr. Juan Pablo Uribe, and Dr. Bruce Aylward, plus our colleagues online and in the room, and thank all of you in the media for caring about the health of all people everywhere. The UHC monitoring report is available online. You've been sent it via email, and if you're in the room, There's some info in the back on that as well. And as always, reach out to our media teams at the World Bank and WHO if you have any questions. Thanks so much, and have a great rest of your day.